Only 1.19% of Africa's population has been fully vaccinated against the coronavirus. Director of the Africa Center for Disease Control, John Nkegasong, says the low rate of vaccination raises concerns as the continent is experiencing a third wave of infections. Speaking at the weekly COVID-19 briefing on Thursday, he said as of July 5th, a total of 70.4 million COVID-19 vaccine doses have been procured by 52 member states on the continent. He says it's too low for us and at this point in the pandemic. Well, according to the NCDC, 146 cases of COVID-19 were reported in 6 states and the FCT, another high for the daily toll this week. It also comes hours after the NCDC reported the Delta, a highly infectious variant of COVID-19 in the country.
The Nigeria Center for Disease Control, NCDC, reports that it has found a confirmed case of the Delta variant of COVID-19 in a traveler to the country. According to it, there is evidence that the Delta variant is more transmissible than other variants of concern. So the agency is reiterating the need to wear a face mask in public, wash hands frequently, and observe physical distancing while avoiding crowds. 146 new cases of the virus from 6 states and the FCT made the news in the past 24 hours, higher than the previous 24-hour cycle, which recorded 110 cases. Lagos had by far the highest number, with 110 cases. Enugu had 18, Oyo 7, Rivers 5, Gombe 3, the FCT 2, and Kaduna had the least with 1 case. The latest update also includes 0 cases from Plateau, Nasarawa, Ekiti, Imo, Kano, and Sokoto states. The total number of confirmed cases in Nigeria now stands at 168,256. 7 people have been discharged in the last 24 hours, raising the total number of recoveries to 164,415. Again, there were no casualties, leaving the fatality toll at 2,122. Currently, there are 1,719 active cases in the country, while over 2.3 million samples have been tested so far. The Africa Center for Disease Control reports that Nigeria has administered over 3.9 million vaccines so far. More than 75.63% of vaccines supplied have now been administered across countries in Africa, while there are over 5.8 million confirmed cases and more than 149,000 deaths on the continent. Globally, there are over 185 million confirmed cases of COVID-19 and over 4 million deaths.
The federal government's meeting with medical doctors and other health professionals to fix a new hazard allowance in Abuja has ended without an agreement. The meeting has also been adjourned indefinitely, pending when parties in the negotiations harmonize their demands. Addressing journalists after a meeting of the Presidential Committee on Hazard Allowance at the Banquet Hall, the Minister of Labour and Employment says that both members of the Joint Healthcare Workers Union, JHESU, and the Nigerian Medical Association, NMA, needed time to harmonize their demands, just as the federal government also needs time to study the new proposals from the health workers. According to him, the government is working to ensure that all the demands for an increase in hazard allowance to health workers stays within the initial 37.5 billion naira, an earlier proposal made by government to the workers.
The two big bodies have given their final position now. So government has taken the final positions back. And I also allowed them, because their positions differ, we have also allowed them time to see if they can discuss among themselves, like they did just before the COVID, and we came out with a COVID hazard allowance. But giving them that time, that's an important opportunity to see if they can meet and harmonize their positions. A quantum of money, that's 7.5 billion. That's what it comes to. So we are trying to work within that realm of 37.5. The proposals they have submitted differs, and they're not able to harmonize down. We also will take both positions back to Presidential Salaries Committee and look at it with salaries, incomes, and wages. And then we can then take a government position based on that. We are adjourning Sinedai for the government side to also look at those two positions, see whether we can do a middle of the road.
Over to Taraba State, residents there are asking government to come up with more stringent measures to curtail the second and possibly third wave of the coronavirus in the state. This is coming as the state has ranked number 27 from the top and 11 from the bottom of confirmed cases, an increase that has some of them concerned.
This was the situation a year ago where no one was allowed into any public building, office or even bus terminals without strict adherence to safety guidelines. It was the same at the borders between Taraba, Benue and Adamawa State, where those caught by security agencies for not complying were isolated and treated for days before being let go. Unfortunately, individuals, organizations and public places have dropped these standards, and fearing the onslaught of another wave, residents are calling for reinforcement of the measures.
In some worship places where we used to know mostly, if you go there, you find out there are places they kept all those things, hand sanitizer and the rest of it, but it's no longer there anymore. We don't know whether they have received some information that it's no longer required for them to do those such things anymore.
My advice to the state government, they should take major action so that they will enforce the law of using face masks, sanitizers, and social distance.
The state government says it is keeping track of the goings-on and outside the country and is deeply concerned by the nonchalant attitude displayed by residents despite ongoing sensitization. It is determined to prevent infections in the state from getting out of hand and proposes to engage people of influence to disseminate the message.
The truth of the matter is I am more than worried because of the simple fact that I knew quite all right that the pandemic is very severe. For us to achieve total protection for individual and then the community at large, each and every one of us have a role to play. We'll continue to advocate, we'll continue to sensitize, we'll continue to educate our people through our religious outlets, the Christian Association of Nigeria, Muslim Council, traditional leaders, religious leaders, opinion leaders.
For now, the state has recorded 1,001 cases of the pandemic, a situation which health experts believe will turn ugly if proactive measures are not employed by both individuals and government to ensure safety.
The highly contagious COVID variant, Delta variant, has been detected in Nigeria. The Nigeria Center for Disease Control, NCDC, confirmed the index case of the Delta variant in a statement, adding that the variant was detected during routine tests for inbound travelers in Abuja. Now, this variant is recognized by the World Health Organization as a variant of concern and linked to the recent spike in COVID in many countries. Joining us for more on this development is Dr. Blossom Maduafokwa, a public health physician. She joins us via Zoom. Thank you for joining us on the program.
Thank you so much for having me. Good evening.
Good evening. Now, given all we've learned about the coronavirus since it started, were you surprised by the detection of the SARS-CoV-2 Delta variant in Nigeria?
Honestly, I'm going to be honest with you. I was not surprised. Because the truth is, it was bound to happen at some point. You know, international borders have been opened, and that with little or no time, this was bound to happen. We know that in places like the US, it's actually becoming the most dominant strain. In the UK, right now, the Delta variant is the most dominant strain. So with open international borders, it's definitely bound to happen. So I'm really not surprised.
What would you say that the measured approach should be for the government, for state governments, and the relevant agencies on infectious diseases to keeping everyone safe?
Okay, so first of all, I would like to commend the efforts that we have actually put in place so far. Because the truth of the matter is the Delta variant actually has become dominant in a lot of countries, a lot faster than we've been, we've actually had the variants come into the country. And that's because of the protocols and the strategies that we've actually enforced, like individuals traveling to Nigeria, you have to register on the NCDC website. You have to upload your negative COVID test. And once you come into the country, you have to self-isolate for 7 days and do a follow-up test. So that has helped to a large extent. The only other layer that we need to put on top of that is the non-pharmaceutical interventions that we've been preaching from the beginning of the pandemic. I believe that that is where I would say our weak point is, because you go out and people are telling you, oh, COVID-19 is all over, we can go about our lives as usual. We need to keep enforcing the wearing of face coverings. We need to enforce the constant, regular washing of hands, not gathering in large numbers. These things actually work. And with this variant that is highly transmissible, we need to really enforce these strategies and these measures to ensure that Nigerians are kept safe.
So perhaps another critical thing right now is, how do we know with regards to the impact of our therapeutics and vaccines on this variant?
Okay, so it's actually, the data speaks for itself. Yes, we know we're not testing enough, but really the what we call the positivity rates, that's the number of positives you will get in any, let's say, any 100 samples. Our positivity rate has really dropped, and that goes to the fact that the transmission has actually also dropped. So we can actually say that these interventions have worked, and we know what can happen when we become lax. India is a case study for the whole world to actually look at and say, once you drop the ball, this virus can go haywire in any country. So these interventions have worked. If you look at what we call the epi curve in Nigeria has dropped very drastically. And that's because of the interventions that we've put in place. And these things actually work. The data actually speaks for itself.
All right. And finally, in terms of the surveillance, this was a variant that was detected in a traveler to Nigeria following the routine travel tests required. Do you think that, are you confident in the surveillance at the ports of entry?
So I had the opportunity to actually oversee some of the work at the ports of entry recently. And I will say that our people actually doing what they're supposed to do. We do have that one traveler who has sort of slipped through the cracks, but we do know that the incubation period for this virus is between 2 to 14 days. So if someone, let's say that traveler got tested when they went before they could test positive, and sort of they slip through the cracks, that is possible. But we can actually give it up to our port health service staff members at the airports. I have seen the work they do, and the work they do is actually effective. It's actually work to keep us safe. We just need to add that extra layer of personal responsibility, wearing our face coverings, and doing all the things that we have to do as Nigerians.
All right. We always appreciate your time on the program, Dr. Blossom Madafoka, public health physician. Thanks for joining us.
Thank you so much for having me.
The World Health Organization says third wave of COVID-19 infections facing Africa could get worse as new and faster spreading variants drive infections. WHO Africa Chief Dr. Matshidiso Moeti says that with almost 5.7 million cases and more than 146 recorded deaths, the outbreak is gaining speed on the continent, with highly transmissible Delta variants spreading to more and more countries.
Africa has just marked its worst pandemic week ever, surpassing the second wave peak. During the week, which ended on the 4th of July, there were more than 251,000 cases, a 20% increase over the previous week, and a 12% jump over the January peak. A few weeks ago, we projected this milestone would be reached shortly, and it really brings me no joy to have been right. In total, on the continent, there have now been almost 5.7 million COVID-19 cases, and 146,000 people, sadly, have lost their lives. New cases have increased for the 7th week running. For Africa, the worst is yet to come as the fast-moving third wave continues to gain speed and new ground in countries. To end this is still going to be several weeks away. Cases are doubling now every 18 days compared to 21 days a week ago. 16 African countries are now in resurgence, with Malawi and Senegal added this week, and the Delta variant has been detected in 10 of these countries.
Meanwhile, COVAX's Managing Director, Auriella Nguyen, says the global vaccine distribution scheme aims to deliver over 500 million COVID-19 vaccine doses to Africa this year. In early March, the CEO of the Vaccine Alliance, Gavi, one of the organizations co-leading COVAX, had said the aim was to supply Africa with 720 million doses in 2021. But later that month, India placed a hold on vaccine exports, deepening supply problems for COVAX, which was heavily dependent on doses from the Serum Institute of India, one of the world's largest vaccine manufacturers, which is making the AstraZeneca shot.
We've been in close discussions with the government of India and with the Serum Institute in terms of resuming of supply. I think it's still a fluid situation given the situation in India, and we've been factoring in resumption of supplies towards the later part of the year. We will be announcing very shortly more vaccines that will be available in the very near term to help increase the immediate term supply. So that's very much the strategy that we've taken so that we can have a resilient portfolio and we can have the diversity and the volume that we need to be able to meet our target to get to 30% vaccination coverage in early 2022.
And away from Africa, Iceland has reopened its visa application centres in India, making it possible for Indians to travel to Iceland. Indian citizens can now visit the visa application centres in New Delhi, Kolkata, Kochi, Mumbai, Bengaluru and Chennai. Till now, the visa application centres remain closed since the pandemic began. In Germany, nationwide, the infection figures have dropped sharply, and so federal states are lifting the remaining coronavirus restrictions. In Germany's most populous state, dance clubs will reopen, and sporting events and music festivals will take place again beginning from today. What does this mean for the government support programs that have been keeping economies afloat in Germany and Europe? Well, Chelsea Delaney, Deutsche Welle correspondent, joins me now from Berlin for more. Hello, Chelsea. Many European businesses have been allowed to reopen as coronavirus infection rates slow. Does that mean economies are back to normal?
Well, many European economies have taken really enormous steps towards normality in the last months. Here in Germany, for example, bars, restaurants, even clubs are being allowed to reopen, and we're seeing more and more people travel, taking holidays. German politicians are now discussing when all of these restrictions might be lifted. The German Foreign Minister Heiko Maas, for example, wants to see that by August, but others like Chancellor Merkel are saying that that's too soon because, of course, the Delta variant, which remains the major threat here and globally. Countries like Spain and Portugal are already really struggling to deal with this variant, and they're seeing their caseloads rise. They're having to reimpose restrictions. Even here in Germany, where nearly 60% of people have a first vaccine, cases have started to rise again in recent days. So even though the economy is recovering as it reopens, the risk that the virus poses to the economy isn't yet gone.
Europe's social safety net and particularly the short-time work schemes appear to have kept many workers from losing their jobs during the pandemic. Will these programs come to an end soon?
Well, these European furlough programs did help subsidize wages for people who didn't have work throughout the pandemic. That kept millions of people from becoming unemployed. But these programs do have an expiration date. They're very expensive, and countries don't want to continue them after the time is really needed for them. Most governments here in Europe, including Germany, are looking to let these short-time work programs expire around September or October. By that point, they think businesses should be mostly back to normal, as most people should have received their first and second vaccines. Already, we're starting to see people get back to work. In Germany, the number of people on these short-time work schemes, known as Kurzarbeit here, fell by almost 1 million in June. That's as workers in the retail, restaurant, hospitality industries were able to get back to work as their businesses reopened.
Finally, Chelsea, are economies actually strong enough for government support programs to be ended?
Economies are strengthening, but there still is a lot that economists don't know about what the long-term consequences of these long lockdowns and more broadly the pandemic will be. Many industries haven't fully recovered and won't, once restrictions are fully lifted, probably won't. For example, the travel industry or the events industry, these won't be back to normal after September or October. And some economies, particularly the poor ones here in Europe, will be much slower to recover. Spain and Greece have unemployment rates that are still nearly twice the European average. So even while we do see stronger economic growth and lower jobless rates broadly across Europe, there are still millions of people and many businesses who have not recovered from this pandemic blow.
Chelsea Delaney, DW correspondent for us there. Thanks very much. Now, finance ministers from the group of 20 countries are meeting face-to-face for the first time since the start of the COVID-19 pandemic. Corporate tax reform, the coronavirus, climate change, food security are on the agenda as they meet. Earlier, African finance ministers had said Western countries should reallocate at least $300 billion of new money from the International Monetary Fund towards investments in Africa to help countries battling the effects of coronavirus and climate change. In an open letter to the leaders of the group of 20 leading economies, finance ministers from Ghana, the Democratic Republic of Congo, Cote d'Ivoire, and Nigeria also urged the leaders to increase support for poorer countries' COVID-19 vaccination drive. Well, remember to stay safe, everyone, and continue to take responsibility. You can visit our website for more updates, also a better understanding of the pandemic. You can find many stories there and breaking news as well. It's channelstv.com. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.